Hello, everybody. Welcome to the Adventures in Brain Injury podcast. My name is Kevin Ballister. I'm a severe traumatic brain injury survivor, host of the Adventures in Brain Injury podcast, and author of How to Feed a Brain: Nutrition for Optimal Brain Function and Repair. And today I'm really excited because Amy Derksen, ND, is with me. And I saw her present at Autism One way back in 2018, and just extremely brilliant, radiant, um, obviously doing this work for the right reasons and really diving into exactly what is uncovering medical mysteries for folks. So, hi, Amy. How are you
Hey,
doing? It's a pleasure to have you here.
yeah, it's a pleasure to reconnect. It's
Totally.
funny, sometimes you have those meetings with people and they stick in your brain, so I definitely remember.
Yup. I reached out to you. You're like, oh, yeah, of
Oh,
course. I
yeah, I
remember
know who you are.
you. That's beautiful. Yeah, it's beautiful. So, Amy, and here, let me do a quick introduction of Amy. She is, she's a former competitive athlete, and she's a naturopathic physician with a full scope practice in Washington State. She did her undergraduate in biochemistry and her medical postgraduate with Dr. Dietrich
Klinghardt.
Klinghardt.
Yeah.
Nice. It's tell me about him.
Where do I start? So he's
All
a
right.
German trained MD,
German, yes.
PhD. Yeah, he started his practice here in the States. Like he had a background in neurology and psychiatry and was working at a pain clinic and found these interesting patterns with people of how things were cycling and knew it, had to be related to something and found toxicity and infection and Lyme. And he's definitely incredibly well known in the Lyme world
Right.
and for those out of the box things. And I was just fortunate enough to connect with him right out of med school. When I didn't have my opinions of how I needed to treat someone, other than I knew there needed to be something different. And so it just, it's a
Nice.
blessing just to open up a whole world of how do you approach medicine. And he does a system of testing called autonomic response testing. So a form of kinesiology essentially, but that checks at a little bit deeper level against the nervous system, and so that's been a gift just as a second opinion to, go beyond labs and go beyond symptoms. And how do you help someone when everything else looks normal, but you feel terrible?
Yeah, that's super interesting. So autonomic nervous system testing
Yeah.
as opposed to like muscle testing.
Yeah. So it does, kind of what standard muscle testing would do, but it checks everything first against a weak arm. So we find some of the big things, heavy metals, Lyme, babesia, COVID, some of these things are going to actually put the system in so much stress that you can't always feel a strong arm getting stronger, but you easily can feel that weak arm going strong. And
Right.
so a lot of times, the things that would be missed with a traditional system, you can pick up.
Amazing. All right, cool.
Yeah.
Cool. So I can go on about Amy's credentials. I mean, she's well, let's see. I know I lost it. There
I'm
it is.
old. I've been practicing for 20
She's been
years.
practicing for 20 years, specializing in Lyme disease,
Lyme disease and autism. Yeah.
autism, and most of the time when people come to you, they have been to several other practitioners, and it's a whole medical mystery
Yeah.
that you get to solve with them.
Yeah.
And you have a really, really beautiful kind of methodology of like pyramidal, like starting with the basics, the foundational piece, and then detoxification aspects, then moving up in that pyramid,
Yeah.
to take care of things from the ground up.
Yeah.
And recently, you've been focusing on post COVID cases.
I have,
All
you know,
right.
the world kind of led to that. And then my own journey with COVID led to, okay, I have to figure this out just so I can keep practicing.
So, why don't you tell me a little bit about your story, and then from as you were a kid, you had a lot of allergies and weakened immune system, and then through to like where you got to COVID times.
Yeah. Yeah. So, I mean, I think we've all, any of us doing this, you have your story. We all have our own that kind of led us here to like try and think outside the box, right? Because inside the box is great if you have something pretty standard. But I had a ton of allergies. Parents were both smokers, and no one ever addressed that. I had pneumonia every year as long as I can remember, and it was always the joke. Like if I got a sniffle, I'd have bronchitis the next day. But on the other side of it, I was like a tough little tomboy, and like I wasn't weak or fragile or anything, but it was just like, okay, I have just some weak areas, and my immune system is a drama queen, right? So it'll be really dramatic. And so, struggled with that. Um, as I got older, started to deal with some asthma, and then some. It came down in college. Had some pretty significant muscle injury. So I was a competitive hurdler, um, and was in a car accident. Just hurt my back, like a low back injury. It was kind of a no big deal. But then I started tearing my hamstrings, and then hurting my calves, and it was just this thing. And it was my senior year. I was leading the nation, and they said I probably wouldn't run again because of these stupid injuries. And I had been, dealing with the physical trainers and doing all the ultrasound, blah, blah, blah for months. And I got a book on natural medicine that came to me from my health insurance. And I was just going through it, and it was like, oh, have you thought about calcium and magnesium? And I was like, no one's ever talked to me about nutrition. No one ever asked that. Okay, I had a budget of like $10 a month to eat on. So I was eating ramen and potatoes is my thing, but training 4 hours a day. And so I went and got the cheapest supplement I could find. And within 3 days, I was able to run again. It was crazy. And so just to realize like how much, and magnesium deficiency has haunted me now throughout my life. And now I know more, and I definitely will not go for that little cheapy something. And I'm eating better. But it highlighted to me how much is overlooked, right? It wasn't an ibuprofen deficiency or needing all these other things. It's, you have to look at the health of the body. And I was lucky enough in college to be exposed to a course on alternative medicine, and that's where I learned about naturopathic care. I did my studies in biochemistry because I'm kind of a geek that way, and I love to overthink and think about methylation and genetics and all those things. But so fun to now be able to apply that in a different way. That's also doing the muscle testing and relating with people and not having me stuck in a lab. And how do we go and take this data and take your symptoms and help you get better. But I have an autoimmune issue myself. So, discovered that after losing a few pregnancies, went into what I thought was a deep depression and a ton of pain. I was having a hard time even lifting my arms, and it was just Hashimoto's. Um, so starting that had really helped me, but it's been really up and down, and being able to tolerate that. And then, a lot of allergies. I started low dose antigen therapy, the LDA therapy, and that has been a total game changer as far as tolerating different environments and just having a little less dramatic reaction. But then COVID got me, man. um January, well, I was like, yeah, like January 1st 2021. It went through the office, half of us got it. Didn't have a fever, didn't have a cough. I just was feeling a little under the weather, lost my taste. And then I had this crazy, so much pain, so much fatigue, as so many of you have all dealt with, but like so much fatigue that I would set an alarm. And my son was in quarantine with me. I'd have to set an alarm for noon to get out of bed by 1 so that I could feed him. And he would have to remind me that I had food being prepared because I couldn't remember that it was going, and I couldn't smell if it was burning. At one point, I forgot his name. I couldn't focus enough to even watch TV. I couldn't talk on the phone for more than like a minute at a time because it was just too exhausting. And so that lasted for almost 6 weeks, and it was really scary. I remember in the middle of it trying to schedule a patient consult with someone I talk to every week. So it should have been an easy thing. I had to prep for 2 hours for a quick little half-hour call, and then it took me another 2 hours to write a simple treatment plan because I just couldn't think. And I remember going through it once I started to pull out of it a little bit, thinking, oh my gosh, this is like all the symptoms some of my most severe Lyme patients have experienced, right? I went from really no symptoms to insomnia, pain. As soon as the pain relieved, there was a rash everywhere the pain had been. Yeah, so I would be wide awake at 1 in the morning and then exhausted during the day, like all the things we all deal with, or like all these chronic patients are dealing with. But at least I knew what the trigger was. It was COVID. And so the recovery process has been tricky, getting back into work, you know, brain recovery and brain inflammation doesn't respond immediately, right? So on the surface, you look okay, you know, and your brain's not working. And I was surrounded by little post-it notes to remember things. I couldn't remember supplement names. I still struggle with remembering people's names. Um, yeah, and the anxiety was crazy. And so it's just been a journey.
Wow. Wow.
But here you
Yeah.
are, right? And you learn in that process. And luckily, as a naturopath, I was surrounded with other doctors around me, and I had all kinds of tools because I'd been working with Lyme disease and chronic inflammatory conditions. So this
Mhm.
was nothing new. It was kind of like, ooh, this is cool. And then to experience it, like, okay, let's do some trials and let's
Let's
do
get it.
this and see what's going on and, see what we can figure out.
Right. All right. Yeah. It's like this was the trigger, but like
Right.
and like you said, you have an immune system that overreacts.
Yeah.
Drama queen, right?
Right.
And it's like you had the trigger step in, and you work with people who, I mean, had we had you had a mutual client who also had some just had COVID and then couldn't remember things, had all
Right.
sorts of like neurological things
Right.
that came with it. It was like post concussion syndrome.
Absolutely.
Yeah.
It can be really different for each person, and it's really hard to know who is going to be vulnerable and who won't, right? Because I was fortunate enough, I didn't end up in the hospital. I didn't have lung issues, but at 6 weeks out, my arms went numb, my legs went numb. I had something, I ended up needing IV steroids to pull me out of it. But, with the patients that I'm seeing, some are dealing with the extreme fatigue that just won't lift. Some are having anxiety and mood disorders. Some are having chronic pain syndromes. Um, and some are just like continually getting sick every month. And it's just, it's a little bit different for everyone what pathway got activated. And so it's been an interesting puzzle, right? Trying to figure that out.
So yeah, I'm super curious with that puzzle. Like, what are you finding most helpful for fatigue with chronic illness or with post COVID?
Yeah, I mean, so our topic was COVID, but it doesn't matter. Like whatever the
It doesn't
trigger is,
matter.
right?
Right.
The trigger set something into motion. So the fatigue can be a few things. I think, regardless of what the trigger was, we always have to think adrenal fatigue, and we absolutely have to think mitochondrial suppression. A lot of these acute illnesses that go into this inflammatory process really will shut that down. And mitochondria, I think of that makes ATP, right? That's the gas
Mhm.
that runs the car. If our tank is empty, I don't care what fancy thing you put on there, you're not recovering. And so that's where things like acetyl L-carnitine is really good, especially for those that have had the brain fog, with that, or the word recall, or some of those things, or just that like there's zero energy to call on, or the weakness, the physical weakness that can come after that. Like where a lot of people were like, hey, I was athletic and now I can barely do a walk without getting exhausted. Acetyl L-carnitine, and the big thing to notice when you're treating mitochondria is you have to go big dose, right? So when I first started treating mitochondria a long time ago, all these things with muscle test well, and I put people on it, and then like feedback was it wasn't doing anything, and it's because I wasn't doing a loading dose. And so all of our cells have mitochondria, and they're greedy, right? So if you're taking a pill, the first cells that are going to get it are all around your gut. That's not going to make you feel more energized, right? So you got to give them what they want and get enough in there that it's getting there to our brain and our adrenals and the rest of our system. And so, like carnitine, we're probably doing 2,000, maybe even 3,000 milligrams a day. CoQ10 is really helpful. I usually do 400, maybe even 800 a day, depending on the level of fatigue. Alpha lipoic acid can be really helpful for that as well, especially if there's neurological symptoms, weakness, tingling. Um, some of that, the alpha lipoic acid can be great. Trying to a big player that I learned about recently at the Forum for Integrative Medicine is the importance of B1. So fat soluble
Yeah,
B1
yeah,
phenphthyramine,
yeah,
I
thiamine.
love this. So,
Seriously.
referred to as the gateway to the mitochondria, I had used B1 for years to help kids on the spectrum with speech. We would do these high doses. And what we're seeing though is, we're always thinking, okay, oh, B12 and folate and those things. But if you do that kind of stuff and it makes you feel buzzy or makes you feel tired, especially, you've got to go back a step and do mitochondrial stuff. So B1 and sometimes B2 can be good.
Mm.
So one, I'm usually doing like 200 twice a day with an adult, and that can be fantastic.
How much was that?
200 milligrams twice a day
200
as
milligrams.
benphthyramine.
Gotcha. Um, yeah, I mean, also there's a lot to be said about high dose thiamine for Parkinson's symptoms
Absolutely.
as well.
Yeah. I mean,
Um,
I got to say, probably in my practice, at least 50% of people are put on B1.
okay.
Not always kept on it long term, but I have seen it, like I said, with autism helping with speech and with any of my chronic patients. It's shifted things for them.
Is there a form you prefer?
Yeah, the benphthyramine. So I use one from Pure Encapsulation called Benfomax. I've liked that.
Gotcha. And then what about for B2?
For B2, I use B2 has been used like in headache syndromes, for
Uh-huh.
migraines and those things, maybe, gosh, 100, 200 milligrams a couple times a day. I've actually really been liking the activated form. So riboflavin 5 phosphate. I just use a pretty low dose from Thorne. I think it's a 30 milligram pill. So I just use one a day. Sometimes I've gone higher, like if someone's having symptoms with the higher doses of B1, we may have to go up. Like if they get air hunger or something like that, we might need to go up on that. But I've got to say, B2, I do a lot of organic acid testing on people. That gives us a ton of info. Like I used one from Mosaic Labs, which was Great Plains. And so they do have a lot of markers that look at B vitamins and mitochondrial function. And B2, probably 80% of my kids on the spectrum are severely deficient in B2. And so that's a really important one to think about.
Wow.
And we
Okay.
don't often need that one long term, in my experience, maybe a month or 2 months.
Okay.
Yeah.
Okay. Great. That's
Yeah.
awesome.
And then
That's
adrenal
awesome.
wise, good old adrenal cortex does the job. So
Uh-huh.
if someone's dealing with fatigue, and I would say whether it's Lyme or whatever, or like you're just not kind of recovering, or you've been just stressed out and you're exhausted and you wake up and you're still exhausted, or you have that like you're fine and then after lunch it's nap time, you probably need some adrenal cortex.
Yeah. Yeah.
Yeah.
Cool. And that's organs.
It's
Um,
yeah, it's an organ product, but I think of it,
mhm.
it's food for the adrenals, right? And so
Yes.
sometimes I think when we're hit with something, we're so depleted. Like I love herbal adaptogens, but like if there's no gas in the tank and there's nothing left there, you're asking the body to do something it doesn't have the ability to do.
It's true. Yeah, absolutely. It's kind of like with DHA, for example, is
Yeah.
like something that's very much missing from a vegan diet unless
Yes.
having sea vegetables or rather algae, specifically algae, like
Right.
consuming a lot of algae. And I don't know anybody who consumes a lot of algae. Um,
Right. Because you have to do a
so
lot of algae.
a lot of algae, exactly. And they do make capsules, which is great.
Mhm.
But yeah, there's aspects where it's like having the actual formed formed amino acid or fatty acid or nutrient or whatever is so important. I was curious about with the ALA. Do you see a difference using RL ALA?
I don't.
Okay.
Interesting. I trained with Cutler um, years ago, and he talked about that not needing that form either, that it was just an overpriced version of the other. So no offense to any company who's making that, but it does raise the price. I tend to just use a lipoic acid. There is some controversy of like, do you need to dose this every 3 to 4 hours so you're not mobilizing some metals or not? I've asked a ton of people in the heavy metal world over the years about that because that was like an inner battle that I had. Because how do you get a child to take ALA every 2 to 3 hours? And the general consensus is that 2 to 3 times a day is fine for
Okay.
everyone that I've talked to.
And while we're talking about mobilizing heavy metals
Yeah.
and things like that, so there's two steps in detoxification. You want to talk about that a little bit and how that works, and how if we ramp up one without taking care of the other, we can get into some trouble.
Like, are you thinking phase 1, phase 2 liver
Phase one,
detox?
phase two, exactly. Yeah.
Yeah, I mean, that's a kind of a big topic. So, I mean, I think a lot of times I would maybe even go simpler with that, is
Okay.
when we're thinking about detox. I have a lot of people, because I am a last stop, who, they want the fancy thing. They're like, "Give me the chelator, give me the stems," they want the end stage. And I think the thing is like, yes, we have to be able to turn on the cell ability to detox. We have to help support phase 2 liver detox so that it can make glutathione and these things. And we have to support elimination so there's a pathway for this stuff to get out.
Right.
That's where drainage remedies are good. That's where making sure you drink enough water, to make sure you're moving your body to help sweat and move the lymph, and to make sure you poop every day. And
Hmm.
if you're not, we got to figure out why you're not,
Hmm.
right? Because there's no fancy detox pill that's going to bypass that. There's actually no highway out of the body.
Right. Right. Right.
Yeah.
Okay, yeah, and so just for the listeners, like when we detox things or chelate things, and we really release these toxins into the body, we better get them out, which
Got to
means
get them out. Yeah.
the phase one is getting them out of their cells,
Hmm.
and phase two is getting them out of our body.
Yeah.
And if our phase two isn't getting that stuff and
Yeah.
putting it in the garbage trucks and then taking it out of the scene, out of the city,
Yeah.
your body, right?
Right.
Then it's just piling up trash, and you can get in some big trouble there.
Right.
Um,
And I would say most people who are symptomatic and have that general toxic feel, or they're chemically sensitive, they're sensitive to fragrance, they feel the effect of EMFs, that it makes them almost vibrate all over. Typically, they're having issues with phase 2 liver detox.
mm,
These are the people who try and do an infrared sauna, which is going to be all like phase 1, is moving it from the cell, and they feel worse,
mm,
right? Because you're mobilizing stuff out of the cells. And if it doesn't have a way out, it's just going to redeposit at the most convenient place. And our body had it hidden kind of with the safest place that it could be, right?
right.
So if we move it and someone's feeling worse, we're missing that phase 2 support.
Yeah, the body is very wise, and
It
if
is.
it's got a bunch of stuff that's heavy, that's hard to deal with, or it's not
Yeah.
prepared to deal with, it's gonna sweep it under the rug. It's
Yeah.
gonna like hide it,
It's
right?
like,
And
okay,
like
you go here, 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 here.
right,
Right.
right, right, which
Mhm.
basically ends up in our fat deposits and
Mhm.
visceral fat or whatever. Like usually that's where that ends up.
Yeah.
Yeah,
We store all
yeah,
kinds of things, even emotional things get stuck in scar
totally.
tissue and all kinds of stuff.
Oh man, I have so many like fascial adhesions. I've been doing a bunch of massage rolling, especially on my shoulders and like my
Yeah.
whole brachial plexus. This whole area is like it's bunched up,
Yeah.
and a friend of mine and coach, he's like, "Yeah, you're carrying too much on your shoulders, like
Uh-huh.
figuratively, emotionally,
Right.
and literally, like." And like let's work through that, before we started recording this call, we were talking about how when I had my brain injury, when I fell from a rooftop water tower and I broke all sorts of bones, cracked ribs, um, nasal fracture, lacerated organs, the whole bit, and of course a diffuse axonal injury. I also smashed my teeth together and broke my left molars, the top and the bottom one. And it wasn't what we really needed to focus on at that point. But later, it really started to hurt, and we had X-rays done. And it was like, oh yeah, you have broken teeth there. That's why. And now the root is exposed, the nerve is exposed, so it hurts like crazy. And so I actually wrote an article about this, called Bite Guard, about like what my options were and what I chose to do. And I was aware that having a root canal was not the best long term solution, but I chose to do it, temporarily.
Right.
And that temporarily turned into like 10 years.
Yeah.
So here I am, and I'm like,
Mm,
I feel I feel something off, some toxic, some infection, something. It's very close to my brain also, right?
right.
And so dealing with that isn't something that I'm going to be doing very soon.
Yeah.
But it's like it's also what I've been doing. Do you know much about sodium chloride
Hmm.
or what is sodium chloride mixed with hydrochloric acid turns into chlorine dioxide?
Yeah.
Yeah, yeah. So I've been experimenting with that.
Yeah.
I do a lot of self
Oh,
experimentation
yeah.
with
No,
things
no.
that are
Me
safe
too.
and effective and seeing how that goes.
Hmm.
And I've recently been very lethargic.
Oh,
Um,
like how much are you doing chlorine
let's see.
dioxide?
So what I've actually been doing recently is the sodium chloride, and then I'll put a couple drops in a glass of water,
Yeah.
and I'll take an HCl capsule as well,
Okay.
so that it'll activate in my stomach.
Okay.
And it is, and so let's see. I right now I've got up to 4 drops, I believe.
Okay.
So nothing
Okay.
crazy.
So nothing crazy. Yeah.
Nothing crazy, yeah. But I was just thinking, and I was just thinking today, like, maybe I need to work on phase two detoxification a bit
Right.
more. Because, yeah, I mean, with sodium chloride, or I'm sorry, with chlorine dioxide,
Yeah.
that is a selective oxidizer, if I
Right.
understand it right.
Yeah.
So, what are your thoughts about that? Do you think that's ramping up phase one detoxification?
Yeah, so I think it's ramping up phase 1, but I think the bigger thing is it's also triggering a lot of die off. So,
Right,
when we're killing things, they don't go down easy, right? So they excrete all kinds of cytokines, so inflammatory things and chemicals and things that are going to put more stress on phase 2 detox. People refer to that as a Herxheimer reaction,
right,
right? So it's that immune, inflammatory, and a bit of a detox thing that's going on there. And so, like, I've used a lot of the chlorine dioxide over the years. There was a big trend maybe 15 years ago where we used a ton of it. Great for some of my PANDAS kids to get off antibiotics and those things. Um, with my adult Lyme patients, I noticed if we did too much, I had quite a bit of anxiety that would come up and quite a bit of oxidative stress that they couldn't keep up with. And so sometimes we would have to pulse that a little bit. So I don't think your dose is out of control. I mean, I think that's good. I've had some people go, 30 drops a day, and that's where, you're like,
right,
whoa. Um, but you may need to take a break just to push some antioxidants, or you might want to look a little bit at your whole mitochondrial system.
right. Well, my methodology on it is basically stepping up like a drop
Yeah,
each day, like step up just a little bit more, do like not going from 0 to 100,
right.
going bit by bit by bit and seeing what happens.
Or maybe you swish and spit, so you're not
Right,
having a systemic thing if you're just focusing on the teeth.
right. No, that's
Otherwise,
good.
you might wanna try, like, the I don't know if you've heard of Briotech, but they make a mouthwash called SOS, so it's similar, but it's a lot easier to handle, so it's specific for the mouth, doesn't
Interesting.
seem to be as irritating.
Okay. Briotech. Oh,
Yeah,
I'll take a look at that. Yeah,
Briotech.
super
Yeah, been
interesting.
amazing.
Cool. Cool. All right. All right. And then well let's go back to we've been talking about detoxification and things of that sort. But also when it comes to viral specifically, um are there any antiviral treatments that you find particularly helpful?
Yeah. So, there's a few things. If we're dealing with COVID, I think it's a little bit different than just kind of general viral support. So COVID specific, probably the trends that I have found, every restrain's a little bit different. Um, I really like Chinese skullcap, which also goes by Baikal skullcap. But that one's been tolerated incredibly well. You can get it in pill or tincture form. I really like a glycerite version, so the taste is a little bit more palatable. I get that from Woodland Essence. And so we may push, 2 or 3 dropperfuls 3 times a day. And that often has been good for people for 2 to 3 months. What I've seen with COVID specifically is there seems to be two phases. There's the initial infection phase where your body is wanting more like antiviral, antimicrobial type treatments, and that lasts about 10 days. Then it shifts. That's where a lot of people get better at that point. That's where others of us, it turns into something different, right? That's where mine, it went from pain to a rash. It became this whole cytokine inflammatory thing. And that's where some of the old stuff that you've been exposed to can rear its ugly head. The old Epstein Barr, or maybe you had Lyme that's been under control, or Babesia, especially, that was under control. And whoops, you're having old symptoms similar to that. I
What's
see.
babesia?
What's Babesia? So Babesia is a Lyme co-infection, probably like 10 times more aggressive than Lyme itself, uh, often transmitted by a tick in the same way Lyme would be. Usually with a Lyme patient, I would think of Babesia if they're having a lot of headaches, a lot of pain syndromes, or these very exaggerated responses. And it has a faster life cycle, where Lyme is about every 4 weeks. With Babesia, it's every 3 to 4 days. And so it's like you go off a treatment and symptoms are back pretty quickly. It's a mutation of malaria. So
Mm.
you can have these high fevers, you can have these night sweats, things that are very similar to that. It behaves kind of like a virus and a parasite together. It's a nasty, nasty, nasty bugger. But what I have seen is COVID is kind of similar, not even kind of similar. It is very similar. And so some of the treatments that I find really helpful for COVID. So there's the Bicol skull cap. I really like cryptolepsis. Tincture has been very helpful. Artemisia or artemisinin, which is a classic Babesia malaria treatment, really helpful, especially during that acute phase. What are some of my other favorite ones early on? Like any of your big antiviral combo products can be good that first 10 days. But then the big thing I see is after it shifts, if you're dealing with that like fatigue, it feels more like that chronic fatigue, you have a history of Epstein Barr. There's two products I like. I've got them here so you can see. Sterile 117. I'm not affiliated with these companies at
I
all. So
see.
this is a biogenesis product. So that one's been really helpful. The other one is from Perfect Solutions. It's called Humacell.
Okay.
So Humacell is, I always forget. So sorry.
Humic minerals.
Yeah, it's not, it's a polysaccharide. It's different. It's not your classic humic minerals. So perfect, this Humacell I love for chronic Epstein Barr stuff. And especially for people who got sick with Omicron and had that persisting fatigue, or if they're dealing with that twice a day for 3 months, seems to do the trick. Sterile 117 initially, so this is I should know this, is beta cytosterol C, word recovery, still not there all the way.
It's not
Has
like you're trying to
Epstein-Barr,
remember the word like tooth or something.
but the sterile 117 is based on a product that originally was helpful for a swine flu. And so when COVID first came around, I was like, that product is available again. I bet you it would work. And by golly, it does. So same thing. It's just one pill twice a day, but I do find 3 months is the sweet spot.
So what is that product?
That's the sterile 117 from
Um,
Biogenesis.
all right. Are these all from biogenesis?
No, the other one is Perfect Solutions.
Uh-huh. The human
I
cell?
hesitated even sharing this because I was like, I don't want there to be a rush on
I
people
know.
getting this and then I can't get it
Yeah.
anymore.
No worries. No worries. No worries.
um, so with cryptolepsis, you can do the plain herb. Otherwise, like Research Nutritionals makes a blend called Crypto Plus as a tincture that's liposomal, and that's been really helpful for people.
All right.
Um,
Cool.
yeah. I think the other thing to think about is a lot of this lives in our nose. So at ILADS,
Yes.
which is the big Lyme conference, they were really talking about, they did a study on that and looking at the active virus in the cilia of comparing different people with different genetic backgrounds. And those people who ended up getting sick, you could see like how quickly the virus was replicating living in the nose. And what I know just as a naturopath is, most viruses take 2 to 3 days. to activate and replicate and do their things before they make us sick. So most of that is coming from our nose. And so
Mhm.
probably the number one thing you can do right now for protection is some sort of nasal spray.
Yeah. Yeah,
Absolutely.
actually, I was watching, early on when, Peter McCullough was talking about cleaning out the nasal cavity and the sinuses,
Yeah,
and I mean, neti pots are fantastic.
right,
Thing about neti pots is, they're not really something you can put in your pocket, right?
right.
Um, so I found this product called Pocket Neti,
Oh,
and
yeah?
it's like a little, it's, Himalayan sea salt
Okay.
crystals with essential oils. It's like super simple,
Yeah,
and it's like just like kind of like a Vicks vapor thing, and you just
yeah,
and I mean it's not as
perfect.
good as say a neti pot, of course. It's not flushing
No,
the
but
whole
it's
thing
gonna
out, but
help.
it's killing. It's helping. It's not just blindly killing everything. It's like it's focused on getting pathogenic things out and putting
Right,
those at bay. So yeah, I've been like if I'm like at a party where somebody's sick or whatever, if I'm just around a lot of people, boom, I'll like hit that
yeah.
before or after, and or I just keep it by my bed and do it before and after I wake up. You know, easy
Yeah,
peasy,
no, it's I
easy
think the people who
peasy.
are doing that consistently have been the ones not getting sick, and it's
Yeah.
definitely something I'm suggesting for everyone when they're traveling. Do it before you get on the airplane, do it after. So, like, Xlear,
Hmm.
Xlear, which is just a xylitol nasal
Xylitol.
spray, that one's been good and it's not too irritating. Propolis is good, and you can actually get a propolis oil, so if it's, like, a child and you won't do a nasal spray, you can put the oil and just come put it put it on your finger and put it in the nose. I like so Briotech I really like. So I have this here just so I could show you. So I got like these little like you can get them on Amazon. It's a little diffuser. I don't know if can you see
Yeah, yeah.
doing that? So
Nice.
Briotech you can put straight like in the eyes and this puts it in this small vapor so you can breathe it in.
Wow.
Like I'm fighting something today, which is why I have it sitting here. I'm not trying to do like a weird promotion. Um, but that one is awesome, like, especially if you're like, "Oh, it just irritates my nose," or whatever, or this has been great if someone's getting sick, like, you can really inhale it into the lungs if you don't have a full nebulizer,
Wow.
but you can clear the eyes and anything, and then the other one is a weird one, is Enovid. Can you see that?
No.
No?
There it is. Enovid.
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 So,
Gotcha.
Enovid is nitric oxide, and it's been shown to reduce viral activity by like 94% within a day if you're doing this nasal spray 5 to 6 times a day when you're sick. Talk about like waking your brain back up. So, I've
Yeah.
had COVID a second time, started to have some symptoms, knew about this product, and used it, and I could feel that in the Briotech. I could actually feel like something clear, and it's not even a congestion, it was more that like, "Oh, okay, my brain is back," and then you could feel it wear off, 1 to 2 hours later, and you would just do it again, but it really decreases the viral load significantly, and a lot of people use that for protection, so if you're really immune compromised, you have someone at home with cancer or elderly or some of those things, you have an infant, those can be that can be incredibly protective.
Wow. All right.
Yeah.
Enovid and the others biotech? Is that what you
Yeah,
said?
Briotech.
Briotech.
Okay, yeah.
All right. And it's a
So
what do you call it?
Briotech is hypochlorous acid. So
Okay.
similar to your chlorine dioxide, similar,
Okay. And it's
but it doesn't
a
hurt surfaces. So you can actually put it
humidifier kind of
you can
thing.
put it straight in a humidifier or a nebulizer. You can spray it into your mouth, into your nose, into your eyes. Um, it's a good one.
Looked like it was a built-in nebulizer. Or was that a separate
No, it was
nebulizer
just a
that you
separate
had?
little like for like 10
Gotcha.
bucks on Amazon. You can get these. They're called like
Gotcha.
pocket um diffusers or something like that. It's
That's pretty
sold as a
cool.
beauty product or something for essential oils, but they're awesome for that.
That's awesome.
Yeah, otherwise
Alright.
you can use the spray that it comes in, but it just like I found it was like leaving my face kind of wet and it breaks
Alright.
down to a salt and ugh.
That's so cool. Alright, cool. Look at all the toys you got.
So many toys.
Tools. tools,
Yeah.
I mean.
Hey, the other
Yeah.
antiviral, so I don't forget,
Yes.
um, is lemon balm. So this last year, if anyone has been exposed to COVID and is having a lot of pain, sciatica, nerve kind of stuff, weird back pain that won't go away, I have found that for some people, COVID is really activating varicella, especially in this last year. So that's, the virus that would trigger shingles, right? Or
Mm.
chickenpox if you had that when you were younger. And lemon balm is really great to calm that down, very calming to the nervous system without making you tired. So that one's been really important. And so is lysine for that same thing. So L-lysine is just an amino acid, maybe 1,000 milligrams twice a day until things really calm down.
And so those are both oral?
They're both oral.
Awesome,
Yeah.
awesome. Cool, cool, very cool. Nice. And what about allergy treatments?
Yeah. Okay. So if someone has like an allergy history, that's going to be your flag, right? That they might be having more of a histamine reaction. Like I clearly had a histamine reaction because everywhere my pain was, I had a rash, right? Um, but histamine is very excitatory as well. So it can make you feel anxious. It can make you, I don't know, just feel on edge. So it's not always a rashy sort of thing. Um, what I find is I would think on the allergy side of things, allergy or immune modulation, which for a lot of people, if you've been triggered, so you have chronic Lyme disease, you have had COVID, and now it's like a year later and you're like, I'm still not myself. Something is wrong. And you go through these phases of feeling really inflamed or reactive, and it just kind of comes and goes beyond just trying to identify the trigger and treat that, you need to deal with the immune system response. And for a lot of people, they get into, there's this Th1, Th2 system, and we get into a Th2 dominance, which is allergy, autoimmunity, like all that inflammatory type stuff. And so I like transfer factors quite a bit for that.
So back up a little bit.
Yeah.
Th1, Th2, what are those?
So those are Uh, I'm going to dumb this down a lot just
Cool.
because it could be a whole conversation and I'm
Yes.
probably not the expert to like give the whole conversation, but it's two phases of our immune system. Th1, I think of kind of that like, okay, immune system kick in, let's fight this thing, let's be effective
T
and like go
helper
back to our
cells,
way.
right?
Hmm?
These are your T helper cells.
Yeah. Yep. And
Gotcha.
then Th2 is more this we need to shift and have a balance of Th2, but that tends to, for some people, if we get stuck in that dominance, it's more cytokines, it's more chronic inflammation, it's more allergy, autoimmunity. We just get kind of stuck in this phase. And like we'll see with some people, is your body is like stuck thinking it's just getting sick or just dealing with Lyme, and the infection is gone, but it's still stuck, right? And so they're just super pain, histamine-ish, reactive, just not feeling well. And so transfer factors can be really helpful for that. Like there are transfer factors specific for Lyme, like Research Nutritionals makes the L plus. That's for Lyme and some of the common co-infections to help get that back into balance. What I find post COVID is they make a transfer factor called plasmic, excuse me. So PLAS dash MYC for mycoplasma. But that's for a lot of the other viruses, some other infections. Like there's a whole host of things, but that one has been really good for the weird immune issues that can come afterwards. I also like low dose immunotherapy, so LDI, which Ty Vincent talks about a lot because he came up with it. It's an offshoot of LDA, low dose antigen therapy, which is a traditional allergy treatment that I love and is a huge integral part of my practice. But the LDI is basically doing immunotherapy for different organisms at these dilutions that have been inactivated. So it's basically just the proteins left. But we mix it with an enzyme. You can or cannot mix it with an enzyme. I choose to mix it with an enzyme to help promote T regulator cells to have more tolerance. So we've seen a mix of colds and influenza, really helpful with COVID. There's a Lyme mix that's like 74 different Lyme and co-infection that's been incredibly helpful for my chronic Lyme patients. And you do that like every 7 to 8 weeks, the life cycle of the T regulator cells. And that has been really good over time to really decrease that load and that sort of immune response.
Oh, okay. All right.
A couple other things. Sorry,
Bring
I
it
made
on, bring it on.
I knew I'd forget. There's always like there's so many toys, and it's not that you have to do all these things, and that's the thing.
That's
Like
the thing.
there might be one tidbit in here that you're like, I haven't thought about that, or I haven't tried that, or I tried that other thing, it didn't work. Okay, try something else because
Hmm.
everyone's body is different. So peptides are kind of the new, you know, latest, greatest talk. But I've been using peptides for a few years now, and there's a couple. So the TB4 frag and the thymogen alpha 1 from integrative peptides.
Can you talk to us a bit about what peptides are and how they're useful?
Yeah, so they're specific amino acid sequences. They're basically cell signaling molecules that our body would normally make to signal basically a call of duty. Like, what is the body supposed to do as response to this? And so they're very healing. Like some of the main ones, like I'll just talk about a few main ones. So our like our thymogen alpha 1 or our TB4 frag have more antiviral properties to them. They're very anti-inflammatory. It can calm some of these immune reactions, especially the thymogen alpha 1 or TA1 when we had access to it here in the US. Um, and I'll just leave it at that. Uh,
Hmm.
but could be really great for chronic conditions. Like you would do this loading dose, and then you can maintain either with injections or with pills. BPC 157 is another one.
Hmm.
Is a signaling molecule that our body would normally do of like, hey, repair this injury. So I think of it as repair for soft tissue. They started doing that with athletes for recovery and, you know, help with some of the stuff. And they found all of them were like healing up their guts first,
Right,
which is really interesting. So, really good for the gut repair,
right,
really great for old weird. Like, I've healed up a weird old snowboarding injury and all kinds of stuff with that, even though that wasn't my intention when I was doing the treatment. But the thing that's nice about the peptides is because they're triggering repair, it's not a temporary band aid, right? It's not just a short term anti inflammatory that's bringing you temporary relief. It's actually healing an issue that's going on there. So I
right.
do find those to be helpful. There's a time and a place. The other thing is prescription low dose naltrexone.
Wait, hold on a second. With the BPC one 57, is that what it is?
BPC, Body Protective Complex,
BPC
157.
157. Yeah, I've used that. I've done injections with that, and then
Yeah.
also before the gut healing properties of it, taking it orally, can that be effective
It
as
can
well?
be effective. Yeah. So I do BPC 157 for a lot of people following like an antiparasitic
Hmm.
treatment, or if we were doing a lot of like Clostridia treatments or whatever, whatever your protocol was. Maybe you had SIBO and you've done that and you're wanting to now heal things up. You have leaky gut, whatever that is.
Hmm.
Usually 2 to 3 months, usually 3 months is better of just a pill twice a day of the BPC 157 can make a huge difference.
So BPC 157 is in
Yeah.
pill form.
It can be in pill form, so integrative
Okay.
peptides does offer that. I think if you're going for specific injuries, I do like the injectable.
Hmm.
There is
Yeah.
some issue going on right now with compounders not being able to do that here in the US,
Right. Yeah.
which is
Yeah.
unfortunate because it has been amazing.
It's really been helpful for folks, and yeah,
Yeah,
it's interesting how these rules pop up for things that work. It's like,
I know. It's always the things that work,
it's
right?
always the things that work.
Right? And it's
Yeah.
because someone made a claim because they saw it, but
Right.
you have to be careful.
Interestingly, you were talking earlier about how like you read something your health insurance gave you some
Yeah,
on natural medicine, which is amazing to me. Like that doesn't happen much anymore.
yeah, right.
But yeah, so and you were like, nobody said anything to me about minerals and
Or anything, right.
right. And so you got a supplement and ta-da, all these things opened up immediately, right? And now it's you're not allowed to say this treat, cures, or prevents any disease or condition, right?
Right.
But what is scurvy?
Right, it's a
R-
deficiency of vitamin C, right?
Right. So what cures it? Vitamin C. What
Right,
prevents it? Vitamin C, right?
right,
What about rickets, right?
right,
What's that? That's a
right,
vitamin D deficiency. What cures it? What prevents it, right?
right,
What treats it? So it's the rules are the rules, and there's
right.
I mean And so, okay, but I think all of us, or many of us, can look at those rules and be like, "Well, those are just stupid rules." But
Or can
and
we
I
just
get it, and
work on it? Like,
we're
it's
gonna work.
unfortunate,
Yeah,
right?
so we work around it, and we play these games around it. But it's like, honestly, the nutrients are powerful.
Nutrients are
You know,
powerful,
extremely powerful. Yeah.
right? Like anyone dealing with COVID probably needs N-acetylcysteine, right? Because
Mm-hmm.
it's really turned on your ability to make glutathione and help with the lungs and all these other things. And I mean, there's so many things, but the
Mm-hmm.
peptides are the same way. And it's unfortunate, it, people make a claim and it doesn't mean that their claim wasn't valid, but then just put in a note with it that
Yeah,
like,
put little asterisks and say these
asterisk,
have
like this
not
will
been
not cure everyone. It's
evaluated
been
by
shown
the.
to help a lot of people,
Right,
right?
right, right, right.
Worth trying.
Right, right.
It's not gonna hurt you.
Or just say your experience. There's
Yeah,
nothing wrong with telling people about your experience. This is
right.
what my experience was,
Yeah,
or a hypothetical story. If I was in your situation, I'd try this. Like these are things that we can get around these rules.
yeah,
That rules. I mean, that honestly put a big wall on a lot of treatments that are safe and effective.
absolutely.
Yeah,
That's my favorite things. I mean, my go-to treatment isn't available here in the US anymore, but it's the thing that saves me as soon as I'm getting sick. And did I have an IV of it myself this morning? I certainly did. Um,
what's that?
I yeah.
Oh, yeah, okay, nothing.
It's a certain extract of artemisia that is fantastic, and I don't use it on patients. I do use it on myself,
Okay.
but it's unfortunate, right?
Well,
That
what
we
is Artemisia?
what is it? It's a plant
Okay.
product, but it has a lot of antiviral, anti-malarial, anti-babesia properties to it. Um, anti-parasitic. I mean, it's awesome,
Okay. All right.
but it's, different things have different properties. If you take a pill, it's very different sometimes than if you inject it. Um, so yeah,
Okay. And you use it. I mean, you see other infections come
I
along with COVID, right?
oh gosh, for sure. So, influenza, varicella, Epstein-Barr for sure. It can reactivate your old Lyme stuff.
Right.
Um, you know, a
So
bunch of
these are
stuff. You could say
these are
very material thing.
infections that are already in people's body usually that are reactivated by the immune system.
Yeah, I think so.
I think
I mean,
so.
sometimes we have some strains that go around and you're like, okay, everyone is testing for these too. Is this strain just behaving very similar to these two organisms put together? I don't know. There's controversy. Is this a man-made virus? I don't know. And I don't
Right.
want to get into conspiracy theories, but it tests energetically and behaves energetically very different than most things we've seen before.
Right. Right.
And just the fact that not everyone mounts an antibody response. Like how weird is that? We don't see that with viruses. Viruses in general, very classically, are going to trigger an IgG immune response. Um, and here, gosh, I've had people even in my own office. So I'll just start with that. What I've seen is I've had at least three people in my own office where we've done a positive COVID swab. They were sick and they've never mounted antibodies.
Mm.
But then you look at me, I've had this weird post COVID. I struggled to get a positive nasal swab. It took 2 weeks before I finally did, but I still have antibodies at this point as high as anyone who would just have gotten the infection. So
Wow.
it's just so weird.
Yeah. Yeah. Interesting.
Yeah.
Well, yeah. And we don't need to go down the
There's a lot of
theory.
rabbit holes we could go
There's
down.
a lot of theory and rabbit holes and whatnot. So, but what we can do is talk about your actual experience with
Yeah.
patients and whatnot. And so, also curious about, not necessarily post COVID,
Yeah.
or maybe post vaccine,
Mm,
situations. I mean, the vaccine, again, talking just what happened, no theory at all, but
right.
like the vaccine wouldn't have been called a vaccine prior to 2020. They
Right.
changed the definition of a vaccine, which like in early 2020 it was one sentence, and they turned it into, this section plus like and it included viral vector, uh shots and mRNA
Right.
vaccines and whatnot, right? So, so this, the vaccine doesn't behave like any vaccine before 2020, before we
Right.
changed the definition of a vaccine.
Right.
And so I'm curious what your experience has been. I mean, first of all, people who are immunized still get COVID, right? That tells you it's
Right.
not like your classic vaccines
Right.
where your adaptive immune system becomes prepared and shuts it down before it mounts, right?
Right.
So, with that being said, all right. So now what you see is folks who are vaccinated getting COVID, and what do you see with that combination? Is that any different? Like, yeah, what is your
Well,
experience?
it's hard to know, right? Because what would their response have been to COVID had they
Right.
not been vaccinated? We don't know. I It's been interesting. It's been really interesting. I've got to say. So in my practice, dealing with people who are already, I don't know if we want to say immune compromised or immune upregulated is kind of more the thing, right? In general, I have a lot of allergy, autoimmunity, autism, Lyme disease here. My patients weren't really that impacted by COVID. Oddly. I mean, not to say that we
Interesting.
weren't, but we didn't have hospitalizations. We didn't have any of those things, probably because, we've already been dealing with immune system stuff. And I did have some people with vaccine reactions where we clearly saw they had the vaccine a couple days later, big cognitive issues, hormonal changes, like quite a few women like stopped having their period or started spotting for months. And there were some weird things that happened that I witnessed, right? And those were in my practice, those who tended to have more allergic responses and tended to be the overreactors to things in general. Um, it's been interesting because so the vaccine reactions are a little bit different than what I've seen with other vaccines as well. I'm just thinking a little bit about so LDI has been really helpful, and what we find is it's not just to COVID, but we have to mix in this influenza, and that has helped if we can get that really quick to someone who's having a reaction. We always know with vaccines is it does temporarily have some compromise to the brain. That's just partly how vaccines work. So our antioxidants. You left me.
All right, we are back up. Technical difficulties. The authorities shut us down. We're gonna try this again. So what we were talking about was I was asking about not necessarily COVID symptoms, but but um, but vaccine symptoms and how we differentiate those. And it's difficult. You were talking about that.
Yeah. Yeah, so
Can
it is difficult, that the post-vaccine reactions for some people who've had them, just in what I've observed, and it hasn't been everyone. For a lot of people, it's been sort of a non-event, and I've got to say with a lot of my chronic Lyme patients who've chosen to get vaccinated, it's we had this big build up to it, and it wasn't a big event. But I have had patients seek me out for vaccine reactions that they've had, and I have had a few of my patients who chose to do a vaccine have reactions, and I've seen that with other vaccines over the years as well. So it's not a reaction that everyone has, but typically it is. There's either this inflammatory response that seems to happen, similar to what we would see post COVID, right? Except with the vaccine, I do see an exaggeration of some of those spike proteins for some people. And what that looks like is, the initial vaccine is fine. And about 2 days later, we'll start to see sometimes I've seen evening fevers. I've seen menstrual changes. So people who hadn't been having menstruation for years, some started spotting. I've seen just irregular cycles. I've seen fatigue. I've seen just some funny reactions. What I have found to be the most helpful are some of our immune modulators. So famotidine, which is Pepsid, is an antihistamine that's been really
you
helpful for that. Ivermectin as an anti-inflammatory has been quite helpful for that. Typically like a 5 to 10 day protocol. Research Nutritionals makes a product called Histoquel that has luteolin and a few things that cross that blood-brain barrier. That's been really good for that inflammatory response. Pushing doses, maybe 2 pills 3 times a day. Some of the peptides that I spoke about earlier, like the TB4 frag or KPV, either one of those from integrative peptides can be helpful. Again, just kind of pushing it for those few days. And then glutathione is always with any sort of vaccine reaction. Everything I've seen over the years is about this like vascular shutdown and a bit of the shutdown of glutathione production that happens just as a normal vaccine response. So pushing glutathione for the first few days for sure, 500 or 1,000 milligrams is the liposomal can be really good if you don't have glutathione or don't tolerate that. N-acetylcysteine can be incredibly helpful. Dosing frequently throughout the day for a few days just to pull through the reaction. I don't find antivirals are necessarily needed for vaccine reactions because it's not a live viral vaccine. Um,
Mhm.
and so that doesn't seem to be the problem. Sorry, I
The,
my phone off
the,
because we took a temporary pause.
all good, all good. And well, and it sounds to me like the treatments for post-COVID are similar to the treatments for
For post-vaccine.
post-vaccine. Yeah,
Mhm,
so
absolutely.
they're very, very, very similar.
Yeah.
What
So
is
the other thing that
observing
I
here?
tend to do, so, I guess on the other side of that is if you're choosing to get vaccinated, what do you do
Mhm.
as protection? And so that's
Yeah.
probably the number one question that comes up in my practice is, there's a lot of fear around this. People who have either reacted to vaccines in the past, and now we know we're going to be exposed to COVID. I mean, this is kind of the new flu, right? And when do we make that decision? Or if someone makes that decision because they had to for work or they're pressured by their spouse or whatever that is, so typically I do a vitamin A and vitamin D protocol, which I do
Mhm.
normally for like immune boosting as well, like before travel or cold and flu season, where I do a high dose of vitamin A as long as there's no risk of pregnancy. So vitamin A would be 100,000 units twice a day for 3 days. And then
Mm.
vitamin D, which is really important for immune system responses, I usually do a 50,000 twice a day for 3 days, starting a couple days before the vaccine. I do glutathione as a given, so just part of their prep protocol. Glutathione starts that night, and we do it for at least 3 days, and then kind of watch through any reactions. I'm trying to think what else. I have on hand Alka-Seltzer Gold or Trisalts. So if they're feeling reactive, reaching for that can be incredibly helpful for the cytokines, or having the Pepsid on hand for that in case they're feeling reactive, and those won't interfere with the impact of the vaccine, the positives of the vaccine that we're trying to achieve. Um,
So Pepsid, are you talking about like
like the antacid.
antacid? Okay.
Yeah, so the active ingredient famotidine in there is an H2 histamine blocker, which seems to be
Mm.
a very specific histamine pathway that's activated specifically with COVID. And so it really helps for that weird, foggy
Off-label.
pain reaction that's going on. And for a lot of people, they've done well. Like if they got sick and then they're just not getting through it, that's been a good one.
So that also blocks stomach acid, which is
I
extremely
know.
important for our
Right.
digestion. So do you also introduce HCl?
I do not.
Okay.
What I find, so I would never do this treatment long term.
Mhm.
But what I find is when this pathway is so activated histamine wise, because that was my biggest fear is like, oh man, right? So I have all these people we've worked years to get their gut health better, and now I'm going to put you on an acid blocker. That makes no sense.
Right.
But what I find is when the histamines are so high, I swear like the medication is just neutralizing the histamine, and it's having much less effect on digestive function. And I haven't seen any issues with malabsorption of nutrients or anything. And I'm typically not doing this protocol very long. I think the longest I've done is maybe 2 months because someone was having a prolonged reaction and it was helpful. And whenever we tried to come off, she was having more symptoms.
That's super interesting.
Yeah.
Okay. Also you brought up how some of your chronic patients,
Yeah.
where it was like a big deal, like worrying about the vaccine and whatnot. Well, some of them didn't have a huge. It was kind of a non-issue.
Which is, yeah.
Which actually got me thinking about some things because you do a lot of things fortifying their immune system and
Hmm.
balancing their immune system, and
Right.
helping them fight off things, and nutritionally. I was also thinking about some studies that are out there in the literature, obviously not promoted, but these studies showed that vitamin D sufficiency was
Yeah.
more protective against
Yeah.
hospitalization than any of the vaccines.
Yeah, no, there was a study in Brazil, gosh, probably 10 years ago, and that they were finding that getting adequate vitamin D levels was more protective than the flu vaccine for prevention of flu virus. And that's why, loading up on vitamin D is part of my normal vaccine protocol. And really, anyone in my practice is going to be on vitamin D, even if they live in a sunny climate. We're just not seeing vitamin D levels being adequate. And most people, I've got
Mhm,
to say, so I tend to do pretty high doses. Like long term for adults, I'm doing 5 to 10,000 a day.
mhm,
The risk with vitamin D longer term could be the raising of calcium, and you can just screen with a chemistry panel regularly to make sure that's not happening. I
mhm.
haven't seen it. I have had probably 2 people where doing vitamin D will spike their levels, and there's some thought that, like, gosh, getting vitamin D levels over 200 has some anti-cancer benefits and those things. You just have to track calcium to make sure you're not
Right,
raising calcium and triggering like a parathyroid issue. But like I said, I haven't seen it. My colleagues haven't seen that. But you can
right.
track it.
And I assume you're also, bringing vitamin K2 in with that
Yes, especially if
too.
you're doing long-standing dosing of that, I think it's smart,
Yeah,
to do
yeah.
like Metagenics makes a really nice vitamin D with K pill where they're already, blended together, or Thorne makes some nice drops for
Yeah,
kids.
yeah, there's some good stuff out there.
Yeah,
Absolutely. Yeah. Well, super interesting as we're stepping into, cold and flu season, and, we're seeing, a new strain or whatever with COVID coming through the pipeline.
yeah.
Um, what are your thoughts about things that we can do, to, for protection, some tips for protection
I would say
during
put
this
something in
season?
your nose, like we
Put
talked about
something in your
earlier.
nose, like,
Put
yep,
something in your
yep.
nose whenever you're around other people, and if you forget, then do it when you get home, or do both.
Yeah.
So I've done this for years with teachers who were pregnant, right? If they're a third grade teacher, you're going to be around snotty
Mhm.
noses all day. And
It's
you
not
use
even
nasal sprays, they weren't getting sick, because you
yeah.
can't do a lot of things when you're pregnant. And so I've seen this work. I've seen this working with my other patients. So number one, some sort of nasal spray, even if it's saline, but something like Xclear or Propolit, which is a propolis nasal spray, or the ACS Silver, whatever,
Nice.
or like your little pocket neti is
Yeah,
awesome, right?
yeah,
There's essential oils, there's any of those things in there.
yeah.
Get your vitamin D levels up. If you don't know what they are and want to be conservative for an adult, 5,000 a day is smart,
5,000. Yep. Yep,
you
yep.
know? And, you can do a pulse if you want to with vitamin A, as long as you're not pregnant. You can take zinc, especially if
Yep.
you tend to
Yep, yep.
run low in zinc. That seems to be incredibly important. You
Mhm.
can make sure your gut health is in order. So cut back on sugar and carbohydrates, drink enough water, eat enough protein, make sure you're pooping, and maybe take some probiotics if you're having some dysbiosis, because that again is our contact source, right? So if we can heal that up, it's going to make us stronger.
Perfect.
Those would be the easiest,
Yeah,
non-fancy
yeah, yeah. Things that we can do pretty
things we
easily.
can do that work.
So I'm gonna put a bunch of links, on the page. You can go to feedthebrain.com/Amy, and it'll have the podcast and all the links and whatnot.
Yeah,
And where can people find you? You're fantastic. I am
thank you.
so appreciative that you're here. Like, you're brilliant, and yeah, all the things. So where can people find more about you? You practice in Seattle, right?
I'm in the Seattle area, so I'm just north of Seattle. My website is holistichealingarts.org. I am supposed to be active online for everybody around me, and I've been fighting it tooth and nail, but maybe you'll find me on Instagram if I ever get my act together. I am trying to develop something with a colleague of mine, Dr. Talia Hale, that we really are trying to develop this online teaching forum and those things. So that
Nice.
has been in the works. I will keep that updated on my website, and I try and post information. You can request to get on my mailing list. I'm a little more old school, so I send out constant contact notifications, not that regularly, usually
Mhm.
quarterly, of whatever pertains to that season. So if we're finding a trend with COVID, if we're finding something that's really working, if there's a new treatment to consider, it's meant to be informative that way and not meant to be sales pitchy. So do feel free to sign up for that.
Perfect. I will. I'm on it. I'm on it right now. I'll get on there. Um, Thank you so much. Thank
Yeah,
you so much, Amy. We'll be in touch, and I'd love to have you back on here.
awesome. I love it.
Awesome.
Have a great day. Thanks for having
Thank you. You too.
me.
Absolutely.
Bye-bye.
Someone take me to a doctor.